We can start now?
Yep.
Okay. All right. Okay, welcome to Indonesia Project special webinar on global development and health. My name is Arianto Patundro. I'll convene this series with Nur Kamala Mulyani and Ruth Nikijulu. We acknowledge the first Australians and pay our respect to elders past, present, and emerging. We are grateful for the support from the Australian National University and the Australian Department of Foreign Affairs and Trade. We have run this series for more than 1 year now. We have invited observers, academics, private sectors, NGO representatives, as well as policymakers to discuss the many aspects of COVID-19 and the economy. Today, we have another very special session with 3 distinguished guests, Professor Mari Pangestu, Professor Tikki Pangestu, and Professor Hal Hill. Professor Hal Hill will chair the session, and so I will let him introduce Ibu Mari and Pak Tikki. But let me say something briefly about Hal. Hal Hill is the H.W. Arndt Professor Emeritus of Southeast Asian Economies at ANU. He is an author of 20 books and hundreds of journal articles. And he is a fellow of the Academy of Social Sciences in Australia and has been an official guest of the Republic of Indonesia under its Presidential Friends of Indonesia program. Last year, Hal was appointed an officer of the Order of Australia. Well, thank you so much, Pak Hal, for accepting our invitation. Now, over to you. Silakan, Pak.
Thank you very much, Acho. Thank you very much, Acho. And good morning from an unusually misty and damp Canberra. I'm Hal Hill, and it's my great pleasure and honor to be in conversation with our 2 illustrious guests and to be part of the mighty ANU Indonesia Project webinar series. It's a case of good morning to one of them, Professor Tikki Pangestu in Singapore, and good evening to the other guest, Professor Mari Pangestu in Washington, DC. Terima kasih banyak, Mari, because it's pretty late already in DC, so thank you very much. It's a very special session because we're going to talk about the big issues of the day in the world, and both of our guests are highly qualified to do so, coming from their complementary backgrounds of health and economics. The guests actually need no introduction, but I can't resist the opportunity to talk about them a little. So Professors Mari Pangestu and Tikki Pangestu, they're actually a brother-sister combination. And I'm guessing this may have even been the first occasion they've been in a public event like this. So thank you very much. Let me introduce them briefly. Mari is currently the Managing Director of the World Bank and its headquarters in charge of development policy and partnerships. Mari's had a remarkable career with many highlights. She served for a decade in the President SBY cabinets, initially as Trade Minister, then as Minister for Tourism and Creative Economies. In addition, she's had a stellar academic career, both at the University of Indonesia, where she's taught for many years, and at the wonderful Center for Strategic and International Studies in Jakarta, where she was for a period also Executive Director. One of the really salient features of Mari's work is that she covers so many areas. She works across the field in economics and related public policy, international economics, macroeconomics, living standards, industrialization, and so on. She's also played a wonderful role in nurturing many younger Indonesian academics, and especially younger women academics. I speak from personal experience. She sent quite a few to me. Now, so that's Mari. Tikki has also had a remarkably distinguished career as an academic and international public servant. He's currently a visiting professor at the Yong Lu Lin School of Medicine at the National University of Singapore. For 13 years, he was at the headquarters of the World Health Organization, running its research policy and cooperation department. Prior to that time, Tikki was a long-time professor of biomedical sciences at the University of Malaya in Kuala Lumpur. He specializes in infectious diseases. And could there be a more topical issue at the moment? Under that umbrella, he has very wide interests: global health challenges and governance, universal health coverage, biosecurity and pandemic preparedness, vaccines and vaccine hesitancy, and much else. He's highly published in leading scientific journals, more than 250 papers, 12 books, and many reports. So I won't embarrass them any further, except just to note that there is a special Canberra connection, and we're very proud to have that connection with them. They are both ANU graduates. Marie graduated with a master's, with a bachelor's and master's, and got an honorary doctorate. Tikki with an undergraduate degree and then a PhD as well. In fact, going further, Marie is a graduate of Canberra High School, and I think Marie even Hughes Primary School, and Tikki is a graduate of Deakin High School. Just for those of you who don't know, the reason for their Canberra connection is the fact that their father, Dr. Panglai Kim, a legendary figure in Indonesia, universally loved and known as Pak Pang, was appointed to the ANU Indonesia project in the mid-1960s. In fact, the first Indonesia appointment to the project. Okay, so that's the introduction. Now we get on with the show. So the format is going to be a webinar and conversation. My job is to basically just raise some questions and considerations for Marie and Tikki, and then time permitting, at the end, we'll have some time for Q&A and for chat. So let's open it up. And once again, thank you so much, Marie and Tikki, for joining us. We know you're both extremely busy. So could I start, please, by the general question to both of you, but each of you coming from your different disciplines and backgrounds. Can you give us an outline of the current global situation as you see it? Marie mainly for the economics of it, and Tikki mainly for the health and pandemic issues. Within that, of course, there are a lot of sub-issues to look at, so I'll leave it to you to think about how you want to talk about it. For example, questions like, why have there been such variable outcomes in both economics and in vaccine preparedness and managing the COVID across countries? How do we address global inequities between the rich and the poor worlds, both living standards and also health preparedness? And the global poverty outlook. And another important development just this week has been the important statement by the four heads of the World Bank, WHO, IMF and WTO. So within that broad question, I'll leave it to you how you want to answer it. Marie, could I invite you to speak first, please? And then we'll go to Tikki. Thank you very much.
Thank you, Hal, and thank you for your kind introduction. Indeed, we have lots of ties with not just with Canberra, but also with the ANU Indonesia project, as you mentioned. So I think it's our pleasure, both of us, to be at this webinar. So if your question is to ask me about the current global economic situation, I think if you look at global growth projections, they're actually looking quite good, in the sense that last year the whole world was in global recession, the worst global recession we've had since World War II. This year, especially after the first quarter, we have seen an upward revision of the near-term recovery and economic rebound. And in fact, I think the prediction now is that the recovery is going to be faster and higher than compared to many other global recessions that have happened in the last decades. And even the World Bank, we will be coming out with our global economic projections next week, actually. So I can't give you the numbers yet, but I can give you the direction of travel, if you like, to say it that way. We projected that global economic growth would be 4% in 2021 in January. It's likely to be much higher than that. It's going to be higher than 5%. And this is in line with the IMF World Economic Outlook that came out in April. And a lot has to do with the very, very high growth rebound recovery of the US economy. US economy is growing at 6 to 7%, the highest ever since I think the 1950s. So that's kind of the good news, that there's this rebound that is sharper and faster than before. And even trade in goods, commodity prices, they all have seemed to recover. But the bad news, if you like, especially for developing countries, is that the recovery has been very uneven. So the upward revision is being experienced mostly in advanced economies and some of the larger emerging market economies, especially China. And the upward revision is very much linked with, you can guess this, better rollout of vaccinations and size and length of the stimulus. So these two factors, obviously with advanced economies on average having fiscal stimulus of about 16% of GDP compared to developing countries of 4% of GDP, a lot of difference in the ability to prop up the households as well as the firms. And the vaccine rollout is obviously key. So I will let Tikki talk more about the vaccines, but I think everybody kind of knows this number. This inequality of vaccination between advanced countries and developing countries is very, very stark. I mean, the US right now, we are at 41.4% of the population, and by summer, they expect that it's going to be 60 to 70%. And Europe is also similarly at 20 to 30%. Many parts of Africa are still only at 1%. Indonesia is faring a little bit better at 10%. So there's a very, very sharp inequality in the vaccine access. So I think that's kind of the first piece of differences once you look at the global growth and why the drivers of the differences. And I think the other thing, because if you put a development lens, there are 2 or 3 other aspects to the economic situation, which highlights the increased inequality part of the picture. So one aspect is inequality between countries. Despite countries having positive growth this year, what has happened is that you've had a contraction, and depending how deep you fell last year, to come out of it and get back to 2019 levels is going to take you a couple of years. So 60% of emerging markets, even by 2022, are still going to be at a lower level of per capita income compared to 2019. And they will be on a slower trajectory growth even after that. So meanwhile, advanced economies can get back to per capita income probably this year, by this year, and then depending on what happens in each of these countries, they can grow faster. So the disparity, the catch-up, and the disparity and the catch-up is going to get wider. And then within countries, we know that the pandemic has had a much, much bigger impact on the poor and on women and children. So the latest poverty number that we have, our poverty assessment, is that by the end of this year, the number of extreme poor is going to reach 150 million. Last year, it was estimated to reach about 120 million. This year, it's going to go up to 150 million. And poverty has not increased since '98. Last year was the first time poverty went up. And we do surveys of household and firms, and you are seeing 33% have stopped work, 61% experience a total drop in income. And I think the really scary thing is the impact on human capital. Learning losses in children, which would be irreversible, and children not getting immunized because health funding is going to the pandemic, leading to probably higher prevalence, and then nutrition and food being also scarce. All this is going to have increased stunting and learning losses. The World Bank has this number called the learning poverty. What is the learning poverty? It's the ability of a 10-year-old child to read and understand a simple text. And before the pandemic, the learning crisis was 53%. So 53% of 10-year-old children could not read or write, understand a simple text. In Africa, it's 90%. We predict that because of the learning losses and the pandemic, this learning poverty is going to go up to 63%. So this issue on human capital. On gender, this crisis has impacted women much more than men. There is a definite gender differential impact, whether it's gender-based violence, whether it's not getting maternal and health services. Early child marriages have increased, greater loss of jobs, and women-owned businesses have been impacted more. And like after what happened with the Ebola crisis, once schools reopen, there's quite a large dropout rate, and girls are less likely to go back to school. So these are really some of the issues. So just to end on the global economic prospects, what's the upside? What's the downside? The downside to that rather rosy global picture is if you had a greater more variants, more second or third waves, as we seem to be experiencing, and also financial market stress because of reassessments of growth prospects, potential corporate defaults. We have also seen signs of food insecurity. Food prices are up by 20%. And some countries, some pockets of population are not getting access to food. And in the longer term, you do have the climate risk and the geopolitical risks. And the rollout of vaccines, obviously, is a key. On the upside, there could be a faster end of the pandemic, but I don't think so. I will let my brother address that. SARS came and went, right? That was... I still remember early 2020, we were talking about, oh yeah, it's going to come. It was kind of confined to Asia and then it'll go away. And I guess that's what the previous administration thought too. But certainly that didn't happen. So a faster end of the pandemic or a better control of the pandemic is the upside scenario. And spillovers from major economies. So this is where, how would you position yourself if you were Indonesia? Spillovers from what's happening in the US with trade growth recovering and so on, and potentially investment flows. You could see a potential synchronized economic boom. That's kind of the upside. I don't know whether you want me to stop here or you want me to talk a little bit about what does this mean for global cooperation?
Mary,
Yeah.
I'd like you to keep on talking for the full 90 minutes, but if you don't mind, let me come back to you because there's lots of really interesting points to think about, such a comprehensive overview. So let me come back to these issues shortly, Mary. And now may I invite Tikki to give us an overview on the health issues. Thanks, Tikki.
You're muted.
Thank you very much, Hal. It's a pleasure to come back virtually to my alma mater and to Canberra. I spent 11 years of my life there, so still have a very strong attachment to Canberra. Okay, let me try to address your questions here. Let me begin with sort of a macro view of the current global situation. And I'll just make 4 points here. The first point is that the situation remains serious and, as Mari mentioned, also uneven with regards to the pandemic. Europe and North America are opening up as Asia burns. Latin America is simmering and Africa is holding its breath. So that's the first point, serious and uneven. Secondly, there is growing concern about the impact of the variants that are appearing and spreading all over the world. Third, and as Mari mentioned, vaccines are obviously having an impact. We can see this in the UK, we can see this in Israel, we can see this in the US, we even see it in some Latin American countries. So that's the third point. The final point on the macro level is what is actually the topic of the seminar is inequity in access to vaccines. And this is due partly to this issue of vaccine nationalism that we'll, I'm sure, return to. So that's the big macro picture. You also asked me to sort of comment on what might be the variables that are contributing to the current picture. And once again, I have 4 points here. Firstly, is the slow reaction and response on the part of many governments due to a large range of reasons. And that is being seen now with the surges in certain countries. So that's one variable, slow response. Secondly, obviously, national capacity in the many different countries, especially the low and lower middle income countries, to deal with the surges, partly due to complacency that had set in some of these countries because they previously seemed to be successful. India is a good example. Vietnam is another good example. Thailand is another good example. So that's related to their national capacity and related to the third variable, which is political will and commitment, which unfortunately is missing in some of these countries at the highest level. India would be a good example of that. And the fourth variable, which in my mind is actually one of the most important ones, is social capital, weak social capital. The population, the people in the community are simply not compliant, are simply not cognizant of their social responsibility, so that their behavior endangers the whole population. So those are 4 variables that, in my view, from a health perspective, leads to that. Your second subtopic is how do we address vaccine inequity? To me, having followed this debate, practically, for me, the solution is to increase local production in addition to provision of vaccines from developed countries. COVAX, obviously, Mari knows a lot more about that. But I believe we need to focus on improving local production. This is not going to be easy because some of these vaccines are technologically complex. You have to have production facilities, you have to have technical support, you need to assure quality, and you need to deal with regulatory requirements. But I read somewhere that actually many countries in the developing world actually have good manufacturing capacity. I mean, the obvious one obviously is India. Everybody talks about India, but also even countries like Pakistan, Bangladesh, South Africa, Indonesia, even Senegal, they have that capacity. So if we can promote that, that will help in ensuring self-sufficiency in the future. So that's the first dimension, increase local production in addition to international help in providing vaccines. The second one is better global vaccine governance. Okay, and the vaccine nationalism has really politicized this whole issue. So we need to sort of go back to the era of vaccine diplomacy in the 1960s, go back to the true spirit of international cooperation, which is driven by good science, good evidence, which is the third reason I believe it's been such a problem. In that regard, I'd like to remind you that in the 1960s, there was wonderful cooperation between the Russians and the Americans to develop the polio vaccine, to develop the smallpox vaccine and deploy it. And that led to amazing achievements in public health, like eradication of smallpox in 1978, the almost eradication of polio. That was vaccine diplomacy at its very best. But in a way, that's gone to the dogs, because as we heard recently, the Russians are actually using, subterfuge to try to impugn the validity of the Western developed vaccines through social media and all that kind of thing. So we need to restore good vaccine diplomacy and have better vaccine governance. And I think we'll go back later when you had a question on global architecture. Your final subtopic was on global poverty. I think this is not my area of expertise. Mari has already alluded to the many dimensions of this. All I have noted here is that in 2015, 10% of the world was in poverty and was projected to actually be down to 7.5% by 2021. Okay, then COVID hit, and what I've seen on the latest projection that's actually not going to be reached 7.5%. In fact, it's going to go back up to 10%. So I'll leave it at that. Sorry to be long-winded about that.
Thanks very much, Tikki. You weren't long-winded at all. It was so much important material to get across, and we appreciate it. So standing back from both of you, I get this, as you'd expect, I suppose, a nuanced picture. Definitely some signs of hope. Mari's, the global economy picking up, and Tikki, the vaccine rollouts is occurring in some places, but also lots of concern. And the two areas of concern I hear particularly are the inequality, both between and within countries, and also related, therefore, the need for global cooperation to address these global issues. Of course, we could have a separate session, as we have in the past, on climate change, and the same sort of issues, in a way, global cooperation would arise. Let me then follow up, if I may, with another general question, which perhaps fleshes out some of the point, and you can flesh out further points of your own if you like. The sort of big issue I'm thinking of is standing back. When we get through this, if we get through it, how is the world going to look, both globally and locally? What have we learned from this crisis? What will be different? I mean, the capacity for human nature to learn from, catastrophic events, I'm still a bit of an optimist. We still seem to be able to learn from them, maybe, not always. So how will the world look in maybe 2 or 3 years, assuming we've got this thing under control? And that does lead directly to the issue which you both touched on, which is this need for global cooperation. I thought, Tikki, you really put it passionately and so well, the 60s when smallpox and polio. You could mention also, by the way, food production, the Green Revolution, and all that sort of stuff. So can we talk a bit about what the world might look like, what we've learned, and this global cooperation issue in a fractured world, unfortunately, where the two global superpowers, for example, aren't exactly getting on very well. How do we think about it? And I suppose there's a specific issue with both sectors, both with health and with economics. And so in the case of economics, it's the role of international institutions like the IMF, World Bank, regional bodies like ADB. And in the case of health, WHO clearly is central. Fortunately, the US administration has rejoined the WHO. So could I ask you both to talk about this sort of looking forward a bit and what's needed? Tikki, could I start with you this time, please? Sort of what will the world look like? What have we learned? What sort of cooperation should we be focused on? Thank you.
Thank you, Hal. So I'm going to start by addressing the question of what are the lessons learned. I think the big message here is what I mentioned before. Speed of reaction is absolutely central to this. And within that, there are maybe 3 sub-highlights that I would like to mention. The first one is at the public health level, the important dimensions of testing, tracing, treating, and isolating, okay, at the public health, at the cold face kind of level. So that's the first one. The second one, it has to be complemented with proven public health interventions. In Indonesian, it's called prokes, okay? Proses kesehatan, right? And this is the 3M. Wear a mask, maintain safe distancing, and hand hygiene. So that's the second one, public health interventions. Continue that together with the more public health interventions. And of course, more recent times, the deployment of vaccines. The third thing that I want to mention is actually at a slightly higher level, very wonderfully expressed by Vivian Balakrishnan, Singapore Minister for Foreign Affairs. And he said that the lessons that has been learned, and also obviously applying to Singapore, are to deal with the pandemic in the future. Remember these three things. What you need is, first of all, a good, responsive healthcare system with all the accoutrements, including good informatics, for example. Secondly, you need good governance. You need a central command, interministry task force like Singapore that has done, which coordinates all the different levels. Obviously, it's easy to say for Singapore, but in Indonesia, it would include central government coordinating closely with the provinces and also even with the districts. So good governance, a single objective, cooperation, no conflicts, no confusion, no contradictory messages. Okay, good healthcare, good governance, and thirdly, I come back to this, social capital. That really is the linchpin of Singapore's success. I mean, I want to be politically correct. I'm not going to say that Singaporeans are obedient, but I would say that Singaporeans are pretty good at complying with government directives in terms of the key public health measures. So that's sort of the lessons learned, and obviously it depends on leadership, okay, on political will and commitment, and governments committing resources. And on this issue of social capital, I was just looking this morning at the news that the current problem in Malaysia is mainly due to people simply flouting all those rules under the new lockdown that they imposed yesterday. The sub-question that you had under this lessons learned was around what might be needed moving forward in terms of the global architecture. Okay, and I just want to mention here the report that was released about, I think, 10 days ago, the independent panel on pandemic preparedness and response, chaired by Helen Clark and Ellen Johnson-Sirleaf from Liberia. And one of the key recommendations is, with respect to global architecture, a stronger role for the WHO. It needs to be more focused. It needs to be more independent, especially in terms of funding. And more importantly, it needs to have more authority. For me, the panel's most important recommendation is that WHO should be free to publish information rapidly without prior consultation with national governments, and it should have the authority to send experts when they sense a potential pandemic arriving. Okay, they should have the authority to send experts into the country rapidly and with the right of access. Now, I was quite taken with that recommendation. Personally, I feel it's aspirational. Personally, I think the countries are not going to accept it. But at least make that statement, okay? They also, in terms of global architecture, the panel suggested the formation of a global health threats council. They also suggested additional mechanisms as part of a future architecture to do better surveillance, to have a platform for vaccine development, diagnostics and therapeutics, and a platform for financing those activities. So that's on global architecture, but the idea of having more new multilateral organizations, I'm not particularly enthusiastic about that. Your final sub-question on that was on global trade policy and cooperation. Now, this is obviously Mari's area, but you basically know the current controversy around wavering of intellectual property rights. We can have a whole session on this, but I think intellectual property right wavering is not a short-term solution. I'm more in favor of ramping up local production. And it's not just about intellectual property in terms of trade policy, but it's ensuring supply chains and raw materials for vaccine production to occur domestically. So over to you, Hal.
Thanks very much, Tikki. Again, really fascinating remarks and so much to sort of chew over. I'm struck by this comment people make that we're only as strong as our weakest link, and that is surely central to understanding the public health issue. Incidentally, I saw also, I don't know whether this is correct, but that the funding for the WHO is actually less than that of a major rich country metropolitan hospital. I don't know whether that's true or not, but if it is, it's a sad commentary.
Yeah, it's true, Hal, that the annual budget of the WHO is about $2 billion US. That's the budget for a medium-sized hospital in the United States.
Yeah. And the remark you made on the Clark-Sirleaf report, I haven't read it in detail, but just seen excerpts. It's surely important, isn't it? We have to have aspirational statements, even if
sure.
some countries won't actually join straight away. Okay, thank you very much, Tikki. Now, Murray, let me now pass over to you, please, and similar sort of broad set of issues on general economics and development and so on. Thank you, Murray.
Let me start with lessons learned. I think on the health response, I think Tikki has said a number of things about the lessons learned. The importance of coordination and whole of government approach, and political will and political leaderships and the containment and so on. I would just add one more, and he mentioned social capital. I think the role of communities and the role of communications would be another thing that I would add, and that's definitely, when we look at all the countries that we were working in, the definition of success is also defined by how good they are at communicating, the information, being transparent, and building trust, right, with the society and with the community. And I think I just wanted to mention something on vaccines. The inequality of vaccines is one thing. It's we talked a lot about the access, getting the access to vaccines. And here I just want to mention 2 or 3 things related to that. One is that it's one thing to get the access to the vaccines. So procurement and financing of the vaccines is one aspect of it. But you need to be able to deploy safely and distribute the vaccines safely in the countries. And this is something that should not be underestimated, obviously. We have already heard about vaccines expiring just because the country could not put it in the arms of people. So the World Bank is working in 140 countries together. This is one of the positive things. We are working with WHO, UNICEF, Gavi, and partners on the ground to assess whether a country is ready or not to distribute vaccines. And it's the infrastructure, it's whether you have the health workers to deliver the vaccines. Do you have the systems of registration and be able to monitor and have surveillance of the people that get vaccinated? And communications, because there's so much vaccine hesitancy and misinformation. So if you don't have these things, then you may not be able to even deliver the vaccines on the ground. So I think that's another aspect of inequality. So if you don't address that, you are going to have slow vaccine rollout because you just can't deliver it. So a lot of attention needs to be paid to that. And we are trying to address that gap. And I think the interesting finding is that countries actually, we've done a survey of the 100. We started doing this back in November. Out of the 140 countries, actually all of them have a national vaccination plan. They've identified who should get vaccinated, but only half have trained their workers, and less than half have actually got good communications strategy. So this is really clearly the big gaps that need to be addressed. And then on the supply side, Tikki mentioned about, let me mention the trade issue and the IPR issue here. I agree with him that the IPR issue is only one part and maybe a small part and a longer term issue of the waiver. And in fact, the waiver is already there. It's more about how can you make it easier to use the waiver. But even if you have the possibility of using the IPR, if you don't have the technology, you don't have the manufacturing capability, you still wouldn't be, or the investment to come up with the facility, you will still not be able to manufacture. So if you look at the op-ed that was produced by the 4 institutions, they actually talk about how there is a plan to invest an additional vaccine production capacity of 1 billion doses. And it is intended to diversify production in regions which already have manufacturing capability. So in Africa, it would be South Africa and Senegal. In Asia, it would probably be Indonesia, Thailand. And then in South America, it would be Brazil, Mexico, Argentina. So existing manufacturing capability, how do you beef that up with technology transfer, sharing of the know-how, and making sure that trade can flow, right? Both on the import and export side, the raw material, including the raw materials, as well as not having the export restrictions. Because one of the things about the IPR waiver, the current regime, they waiver it for public health use in your country, but you can't export it, or you can only export it with very, very, very great difficulty. So that needs to be addressed. So I think that needs global cooperation and multilateral institutions to agree. And this is, I think, one of the push by the 4, by WTO, WHO, World Bank, and the IMF. And on trade restrictions, it's not just vaccines, it's also the medical supplies, the therapeutics, the oxygen, and food. Yeah, I would put food in there because food insecurity in the first half of last year, and food prices going up with food restrictions, was potentially going to become an issue. It didn't become an issue, fortunately, but it can certainly become an issue. I think the other things that I would say outside of the health response, what did we learn about the pandemic and the economic impact? I think we learned a lot about various things about pandemic preparedness. So this, there's like 5 or 6 expert groups on pandemic preparedness at the moment, including the one Tikki mentioned, Helen Clark. Pandemic preparedness is not just a health issue, but the moment you have a pandemic, you have lockdown, and you have people not having jobs and losing income. So how do you deploy health emergency? How do you develop, how do you have a social protection system that will have a social safety net system? How do you keep the lights on from micros to medium-sized enterprises? And how do you keep food supplies flowing? So in many cases, there were also disruptions in food supply. And here, I think the lesson learned, a couple of lessons learned. I think one is the importance of data and systems, and the role of digital. So countries that actually had a good social protection system and data were able to quickly deploy and scale up and broaden their social protection system. But India is an example, because India already had a digital ID that was linked to the bank account, linked to the mobile phone. So we could actually deploy very quickly in India. But in other countries, you have no data. How do you do it quickly? So I think the big learning is, how do we now have the data and build up the systems and make them adaptable, so that you need it for health to deliver vaccine. You also need it to deliver social protection. You also need it to deliver skills upgrading systems or support for the informal sector. How do you set up these systems? So we are working very hard with many countries to be able to set this up. You know, for instance, in the case of Indonesia, we had quite a good functioning cash transfer program. If you remember, it started in 2005 by name, by address. But guess what? They discovered, I think, when they were going to deploy the system, it was outdated. It had not been updated for the last 5 years. So keeping it updated was another thing. And then we've had lots of discussions. If you want to register people, do people come and self-register, or does the government enforce it from birth, from the census, or from the birth records or from voting records or whatever. This is a lot of discussion on that. And the moment you have data, and the government has the data, it should be used for the right purpose. But the issue of privacy and the use of data, who gets to use the data, becomes another big issue. And the final thing, maybe two other things, if I may, in terms of learning. I think the other learning is we are very in a panic when we are in a crisis. We want to quickly do responses, but you can do the wrong response and cause harm. So you have to have a do no harm mindset. Yeah, you can introduce policies that are either very difficult to unroll in the future, or actually leads to harm. I'll just give you one example. If you give subsidy for people not to pay their electricity bill or not to pay their rent, but then you don't actually support the landlords or the utility, they're going to go bankrupt. And then at the time when you recover, there's no more electricity company. That's just to give you an extreme example, right? And then the other lesson is, while you're doing the emergency and short-term response, you should have an eye on the long term. So while you're doing the emergency health program, you should be already focusing on strengthening the longer-term health system, and even making it more resilient. This idea of a one health system is very important. I as a trade minister, I went through the bird flu. And at that time, we already kind of knew about the zoonotic nature of these pandemics, that it goes from animal to human. And therefore, there's an ecosystem kind of issue. And then there's the way you should be designing your markets. But 2 years later, we forgot everything, and everything went back to business as usual. So this time around, how can you make sure that you do pay attention to the fact that all these pandemics have been zoonotic in nature? And on just a few, if I may just close on the global cooperation question. I think on vaccines, we made, the 4 institutions have made a very strong call that you cannot have economic recovery without the vaccine rollout. So this is really the key, making sure that the excess vaccines, there's transparency around the supply of vaccines. There's not much transparency either from the private sector or from the buyers about how much. We don't actually know how much vaccines have been booked and how much is being produced, to know how much therefore needs to be produced, right? That's the first kind of call for cooperation by all. And then second, how do you go through a mechanism like COVAX so that you can have the equitable distribution and the concessional financing and grants that will finance the purchase. The supply is an issue. So ramping up production quickly by expanding existing facilities and the technology that needs to go with it and so on would be very key. And not to forget that while vaccines is not the silver bullet, you still need to do the triple T, the containment, and then all the health facilities. And I think, if I may just close with, I won't be able to explain it, but all crises offer opportunities to build back better and to build back differently. So while you are doing short term, you need to focus also on the medium term. And this means better responding to the COVID-19 economic and health crisis, as well as the climate crisis. So when you build back better, how do you design your policies? How do you design your fiscal stimulus to do that? This is the next big thing that we are focusing now on, the recovery and growth.
Not bad. Economists can actually learn about health. I am very impressed.
Well, our worlds are now interacting. For a long time, our worlds were not interacting. Now it's like
it's very good to see.
I cannot solve the health problem. I cannot solve my economic problem.
It's very good to see some brotherly, sisterly cooperation as well. Interchange. Thank you, Murray, for again comments rich in content. I was just thinking, actually, the $50 billion, I think it is, proposed for this vaccine rollout sounds eye-watering, amount of money, but actually it's not that much compared to the global losses during the crisis, is it?
Yeah.
Question, but you don't have to answer, but maybe we'll come back to it later. One of the encouraging features of the global economy this century has been quite a bit of convergence. That is, poorer countries growing faster than the richer countries, especially Asia, but for a decade also Africa and even parts of Latin America. But that figure you mentioned, Murray, the 4% versus 16%, the fiscal stimulus, is just so striking, isn't it? So the worry is that convergence process, except for countries like China and so on, may be really halted permanently. Perhaps we'll come back to that. I want to just go one more round of my questions, and then I better move aside. I see questions already piling up. One, by the way, from the wonderful Hugh Patrick in New York, my mentor. Hi, Hugh. But also I see questions coming from Terry Hull and Titik Anas and maybe others. But let me do one more round of questions. It sort of covers what we've been talking about already a bit, but could you just focus a bit more directly on Indonesia, since a lot of our audience is from Indonesia, interested in Indonesia, and perhaps in comparative Southeast Asian context too. One of the interesting features last year, at least, was Vietnam. Vietnam was the star, as I understand it, in managing COVID. And not now, of course, it's got some problems and it's also slow in the vaccine rollout. But could you give us a bit of a picture as you see it of Indonesia? First with you, Mary, and then Tikki, I'll go to you. Thank you.
Okay, I'll try to be brief because I really want to have more time for the audience to ask questions. I think when you look at the depth of the recession last year, Indonesia also experienced negative 2.1%, but it really fared slightly better than other emerging markets. The whole region, the East Asia region, actually managed to grow slightly positive at 1.2 because of China and Vietnam. But other regions like LAC went minus 6.5. South Asia minus 5.3, and so on. So I think we fared better. And what is the prospect for 2021? The East Asia region, again, is expected to grow at 7.5% in 2021, with China and Vietnam having a real V-shaped recovery of 8.1 and 6.6%. So these, I don't know about Vietnam's prospects now, but this projection was made before the recent developments in Vietnam. And for Indonesia, I think we will still, because we still, the first half was still very slow. We're only seeing signs of growth more recently. And the vaccine rollout, which started out well, has now been a little bit slower, and partly because we didn't get the AstraZeneca supplies from India that had that was supposed to come from Serum Institute. But now with Sinovac already approved by WHO, and I think China ramping up its Sinovac production, and maybe AstraZeneca coming back on stream, these may be good signs for Indonesia to have more vaccine rollout. But I think most of the projections are looking at not for developing countries. East Asia may be faring a little bit better, and not to have like close to herd immunity, not until the middle of next year, right? So while you can still have increased rollout even by the end of 21, I don't think we would have high herd immunity yet. So the growth is likely to be still dampened. But at least our projections are showing that Indonesia and Malaysia, remember I mentioned earlier when I was talking about global projections, how a lot of developing economies, even by 2022, would not have reached back the 2019 level. But at least Indonesia is expected to recover back to close to 2019 level in 2021 if it grows at around 4.5 to 5%, which is the projections by the government and so on. I think the government is 4% something. So that's assuming, right, that you don't have another wave or another variant coming up, another lockdown in place. And I think that the challenge for Indonesia will be, as with all other countries, as we talked about earlier, dealing with the vaccine rollout and the health issue. But Indonesia has actually benefited from the upside on the growth of trade. I think Indonesia benefited from the recovery in trade, not yet on services, tourism, and the other services are still down, but at least on goods, and also commodity prices are recovering. The challenge will be fiscal stimulus. Indonesia, I think, has had a deficit of, let's see, what was the deficit number? I think it was five. What was
Pretty
it?
close,
6% last year. Yeah.
Yep.
For my numbers here, can't find. Yeah, it was around 5 or 6% last year, and then it's going to have to slow down to 5% and then 4% probably next year, and then 3% by 2023, right? Because that was the agreement. So I think for Indonesia, as well as many other developing countries, given the fiscal space as well as the monetary space, how do you how and when you start winding down your fiscal stimulus and your accommodative monetary policy? You shouldn't do it too soon, because it's going to, kill the green shoots of recovery. And what, in your limited fiscal space, what do you need to do to make sure that you are utilizing the fiscal space and the monetary accommodative policy in the right way? And obviously this year, you will still need to have social protection system in place. Otherwise, poverty rates will go up. It has already gone up. And it will, how do you focus on social protection and maintaining as firms? What is the support program for firms? Right now, it's going mainly through liquidity support that's going through the state banks. But what about the informal sector? What about the SMEs? And a lot of countries will face this question. Are you going to be in a position to rescue either banks? Actually, the good news is, I think we don't see a huge financial stress in the financial sector. Although this is not something you should take, of course, lightly. The moment NPLs go up and there's corporate insolvencies, there can be knock-on effects on the banking sector, obviously. Therefore, how do you manage that? And are we going to see a lot of insolvencies? Are we going to only see a little? Should we be rescuing companies or not? And who should be rescued? How do you have the corporate governance and in place? How do you have the transparency and make sure that what you're rescuing are not the zombie firms, but really the firms that actually would, if with an injection, would when the economic growth resumes, will be able to create jobs and economic growth. These are the challenges coming up that countries, including Indonesia, will face. So I could say a whole lot more, but maybe I'll stop there and hope for questions to come.
Okay, thanks very much, Mari. Surely Ibu Ani and Pak Peri deserve a big pat on the back for doing a wonderful job in a crisis year. I should have just mentioned, if I may interrupt, some shameless promotion. I don't know whether people can see this, but it's the latest Indonesia update book from the Indonesia Project, edited by our esteemed colleagues Blaine Lewis and Feraman Witula. And it's, of course, on economic dimensions of the COVID-19 in Indonesia, responding to the crisis. That's the end of the shameless promo. Mari, one of the puzzling features, no need to respond to this, but I'm still a bit puzzled why Indonesia got off relatively lightly last year, minus 2% contraction, when India, Philippines, Thailand had 7, 8, 10% contraction. Maybe we can come back to that And presumably also you'd approve of the temporary unconventional fiscal deficit financing through Bank Indonesia, but maybe that's an obvious one. Sorry, Mary. So Tikki, can I come to you, and then I'm going to open it up for questions. And if I may, starting with the one and only Professor Hugh Patrick, and then I'll go Terry Hull, Titik Anas, and quite a few others. I see Nurul Islani, Ari Pradana, several more. But Tikki, may I go to you, please, for any comments, additional comments you have on Indonesia in sort of comparative Southeast Asian perspective?
Yeah. Just quickly on Indonesia, I had the privilege actually last week of taking part in a webinar organized by a wonderful grassroots organization called Gerakan Pakai Masker, GPM. And I had the privilege of listening to Professor Pandu Riono from the School of Public Health at the University of Indonesia.
We've also had him on this series too, Tikki.
Okay. So Pandu gave me some wonderful highlights. Basically, the title of the webinar was COVID Masih Ada. Okay, so basically saying it's still not under control. Okay, actually there have been a 31% increase in the number of deaths between April 20th and the 4th of May. That's 8th in the world behind India. Cases have come down since the peak in January, but still 750 cases per day just in Jakarta. Okay, the decrease in those which are following the 3M, the PROCAS, has come down. Okay, going back to the social capital issue, partly linked to the mudik, during Lebaran. Pandu mentioned vaccine coverage is still very low. First dose is around 5 to 7%. Second doses less than 4%. This is quite recent data, and he's done some wonderful informatic analysis on this issue. There is good vaccine coverage among the health workers, very important, almost 100%, according to Pandu, but poor coverage in the elderly, around average about 10%. That's the most vulnerable part of the population. And as you know, Indonesia did a shift in the policy from vaccinating productive segment of the population, and now they're saying, let's focus on the elderly. So that's just a snapshot from Pandu on the Indonesian situation. Comparatively to Southeast Asia, it's, obviously it's clear that you can't compare Indonesia and the Philippines, for example, to Singapore or to Thailand because of geography, because of logistics capacity, because of social capital issues. But, once again, I think there are good lessons from the Singapore experience with the right political will. And Mari's already mentioned vaccine hesitancy, good communication strategies with the right messengers, okay? Not just government officials, not just scientists, community leaders, religious leaders, even celebrities, to try and mainstream that, that message. So I'll leave it at that and look forward to some questions.
Thanks very much, Tikki. Including the celebrities, I'll include people like you and Mari, actually.
No.
Now let's open it up. We have about 25 minutes, so we have plenty of time for discussion. And I'll first invite Professor Hugh Patrick, and then I'll go to Terry Hull, and then I'll go to Titik Anas, and then several others. So Hugh, good evening. Can you speak to us?
Yes, can you hear me?
We can, Hugh, and it's very nice to hear you, and I hope you'll keep well.
This has been a really impressive set of presentations and discussions, and a very sort of analytical and empirical, as well as sort of judgment based. I guess my question to each of you is really rather simple. And I feel maybe a little shy about that because it's simple compared to all the rather sophisticated, comprehensive presentations each of you have made. But Mari, I wanted to ask you, you've been speaking quite objectively and analytically. Now I want to ask a sort of a subjective question. What do you worry most about for the global economy? And for Tikki, Pangestu, I want to ask you, what do you worry most about global health?
Thanks very much, Hugh. If that's subjective, I think it's really important as well. Maybe we'll just take this one and go straight to Mari and Tikki, then we'll come back to the other questioners, since it is such an important question. Mari, could I go to you first, please, and then Tikki?
Mute.
I think you're muted still, Mari.
Yeah, for many years, my world and my brother's world were like this. Now it's like, so what worries me a lot about the global economy is, the pandemic, really, the health crisis, because without the successful containment as well as vaccine rollout, I really don't see that the global economy can recover. So even if advanced economies recover, right now the global, I think the number is something like 50 or 50 something percent, maybe close to 60% of global economic growth comes from developing countries. So if developing countries are not going to recover or even actually regress, then the world economy will also not recover. So that's why, when we talk about global cooperation, it is incumbent upon the advanced economies to make sure that there is equitable access to vaccines, because it's not just about doing the right thing and helping the people who can access them. It is also at the end of the day an economic need as well, because without the recovery of these economies, where the demand will come from, the recovery the global economy is not going to recover. And while we have it looks like a V shape, it could be, people could say it's like the W, it can still go down again. And this is really my big worry. That's the kind of the short-term worry. I have lots of longer-term worries because of what we're calling permanent scarring on human capital, on economic assets, on infrastructure, on businesses, on capital, and not to mention the climate aspects and the natural capital. Those are the longer term worries. And a lot of, for me, the human capital scarring, that is really going to lead to a lot of inequalities between countries and within countries. And really that is a scary thought, quite frankly. And how do we design the right kind of policies to at least minimize, if we can't offset it, minimize, and then work towards addressing how improving the human capital, because without that you can't have the productivity that's going to lead you to growth and recovery.
Mari, you didn't mention public debt. That doesn't worry you these
days? Oh yes, sorry, I forgot about that. Sorry.
Suppose global interest rates start to rise, which they may well. Sorry, the possibility of that debt crisis as well.
Yes. That's certainly a big worry, and that's definitely something we as the World Bank, we have been looking at. Even before the pandemic, there were like 60% of developing countries which were already having high debt overhang. Now with the crisis, the number of countries that are having debt overhang, increasing debt overhang, as well as serious debt issues, is obviously doubling and increasing. So the potential for sovereign debt crisis and corporate debt crisis is really a huge issue. And one of the things that we have done in the short term is to come up with what they call a debt service suspension initiative, where official creditors have provided a relief, at least for the service pay to service the debt. Temporary relief, not restructuring, just a relief not to have to pay. And it is for the poorest countries. But that's only a band-aid. The real restructuring that needs to happen is really to reduce the debt stock. And nobody is at the moment coming up with any common solutions yet. But this is the big issue. And as you know, even the Pope has made a call for debt forgiveness, debt restructuring. But this the issue, I'll just close on this. The issue is that it's not just official creditors. I think maybe 2/3 are private creditors. So and they are wide in variety, from banks to bondholders to vulture funds, hedge funds. So it's very hard to organize, like what you did in the 80s with the Brady restructuring. Those were only commercial banks, and it was mainly US banks, so you could easily do it. But in today's world, it is going to be very difficult to do.
Thanks, Mari. Tikki, over to you, please. I suspect that Mari might have actually answered the question for you too, but Tikki, we'd be interested in any comments you have, please.
Yeah, she has. And what worries me most about global health, I worked for the WHO for 13 years, and I'm driven every day when I enter the office building in Geneva by the motto of the mission of the WHO. And it reads, the highest possible level of health for all people. So for me, the pandemic, what worries me most about global health, inequity, social justice, and human rights. I'll leave it at that.
Thanks, Tikki. Very well put. Next, I'd like to go to my near neighbour in Aranda. That's Professor Terry Hull. Terry, over to you, Pat.
Thank you very much. Really appreciate the wonderful organization of the Indonesia Project to put on these Zoom webinars, and it's wonderful to see Mari and Tikki, though from great distances. I have really only one question for Tikki about the source of the COVID-19 virus and how that has become such a political issue. Australia did raise the issue about researching the source and had a lot of pushback from China. We see that there's a lot of conflict between national politicians undermining cooperation on vaccines and treatments. So how important is it for us to know where the COVID-19 virus came from, and will it help us to deal with a future pandemic? Thanks very much.
Thanks, Terry. So Tikki, would you like to comment on that?
Yes, very briefly, I've been asked this question many times. For me, from a public health, from a global health perspective, dealing with the current crisis is the priority. Obviously, scientifically, academically, it would be good to try and determine the source or the origin of the virus. But I can tell you, I used to be a microbiologist in my past life, that to actually get a definitive answer on this, it's going to be almost impossible. Yes, of course, there are possibilities of laboratory leakages, laboratory accidents that has happened many times in the past. But as Terry, you mentioned, it has become a very sort of a political issue. So for me, I think the demands on WHO to do yet another investigation, I think, obviously the organization has to respond to that. But unfortunately, I believe it's an opportunity cost when so many more resources and brain power could be dealt with, could be used to deal with the ongoing crisis in so many parts of the world. But sure, academically, scientifically, whatever comes out of this investigation can be, be used to prevent future pandemics from happening. So I'll leave it at that here.
Tikki, I don't want to put you on the spot, Tikki, but are you saying that we may never really know the precise origins of the pandemic from Wuhan, if it is Wuhan?
Yes, that's what I'm saying, because there are so many other possibilities. For example, the idea that the virus actually first appeared in Europe, for example, in November of 2019. The possibility of animal origins that we haven't even talked about, bats, not just in China, but in different parts of the world. So, how much manpower, how much scientific resources are going to be needed to try to answer what for me is an unanswerable question. I mean, that's just my own personal view as a microbiologist.
I think it's a fundamentally important observation, actually, because so many politicians, sadly, including some here in this country, use it as a kind of, an opportunity to, attack China, basically.
Yeah.
Thanks. Okay.
I think what is beyond doubt is the animal origins, and Mari has already alluded to that. It's very well known, a wonderful survey over pandemics in the last 60 years, that 70% of those pandemics originated in a zoonotic or animal origin. So that's beyond doubt, but the details of that still remains a bit murky. What's the intermediate host, for example? I better not go on about that.
No, thank you. It's very, very interesting, Tikki. Okay, now let me go next to Dr. Titik Anas in beautiful Bandung. Hi, Titik. By the way, after Titik, I'll go to our good friend Ari Perdana in Manila. Both, by the way, were sent to ANU by Dr. Mari Pangestu. Titik, over to you, please.
Thank you very much, Hal. I like to ask both Pak Tikki and Ibu Mari on resolving the issue of supply side constraint. As Ibu Mari already mentioned earlier, and you also, Hal, that the scarcity of vaccine are going to lead to inequality, and that's going to be affecting the human capital development, especially in the poor and developing countries. So this is kind of humanity crisis that we are going to face in the next few years. So I'm wondering first on the global cooperation, while the fund being devoted by a global community is only like 10 times the Indonesia spend on its vaccine at market price. So it's not going to be sufficient. While as Pak Tikki mentioned, relinquishing the copyrights of the private sector's vaccine development is also not a good idea. So what is the way forward so we can prevent this humanity crisis, human development crisis in the future? Should we, although I think the copyrights is the rights to respect the innovation, how we attend or achieve balance between supporting innovation and also solving the human capital development crisis. That's for Ibu Mari and Pak Tikki. Specifically for Pak Tikki, if when you mentioned that we should increase the local production for countries who have not yet produced vaccine itself, and we know that developing vaccine takes years, how can we increase the production, Pak? So those two, Hal, thank you very much.
Thanks very much, Titik. Both very important questions. Just keeping an eye on the time, I wonder, I might now go also to Ari Perdana, and then we'll come back to Mari and Tikki. Ari, can you hear us okay? And selamat,
yes.
pagi, selamat pagi di Manila, yeah? I guess you're in Manila, or maybe you're somewhere else.
No, stay in Manila, stuck in Manila, to be honest.
It's nice to hear from you. Please go ahead.
Yes. Yeah, terima kasih Pak Hal. Sent to ANU by Bu Mary. That's very accurate description. Nice to
Korban beliau.
Korban. Yeah, nice to hear Bu Mary and Pak Tikki today. So on social capital, I think Pak Tikki, Bu Mary mentioned it several times, and I agree. This was a very important and interesting variable for us to test the effectiveness of the measures and the spread of the pandemic. But I think rather than concluding that people not having social capital or social responsibility, I see this as a conflict between different forms of social capital. Because I know that in Indonesia, in India, Malaysia, and also to some extent in the USA, people broke the quarantine to attend religious ceremonies, to do group exercises, or just to maintain relationship by visiting each other in Hari Raya. So people clearly value social capital, and they are afraid to face social punishment if they don't, go to such ceremonies or gatherings. And this exceeds the fear of being infected or infecting others. So I think the question is why this happens, and I don't think we have the answer right now. But this may be a good research, questions. But maybe partly it's also due to the message from the government or the authority, the consistent or inconsistent messages, and enforcement may have the endogenous effect on how people behave during the pandemic. So I think in Indonesia we used to have good public health message. Remember keluarga berencana, 2 anak cukup. Remember the campaign of Pekan Imunisasi Nasional, and we didn't see that during this pandemic or even prior to this pandemic, that led to the low take-up of vaccines. So maybe the specific question to Pak Tikki and Bu Mary, what can we learn from this? And specifically to Bu Mary, what can we in international development partners learn from this situation? Terima kasih, Pak.
Thanks, Ari. I should have mentioned Ari works for the Asian Development Bank as well. So
Yes.
Can I go to you, Mari, first, and then to Tikki? By the way, sorry to be rude, but please feel free to keep your answers short because I see more questions coming in. Sorry about that. Thanks, Mari, to you first, and then to Tikki, please. And I think you're on mute still, Mari.
Yes, I'll try to be brief, and Titi and Ari, we can take it offline if you're not satisfied.
Yes, so that's an option as well. Thank you. Yeah.
So basically, supply is a big issue apart from the equitable distribution of what exists. But I think in the short term, what we are calling for is greater transparency. And the World Bank has now put all the contracts that we have with the countries that we are working with on a website where everybody can see, because you want to know the pricing, you want to know how much and who's providing what. This is actually much needed because that will determine how much, what's the shortage, what's the shortfall that you need to invest in. Second, we are calling, obviously, for the advanced countries that have actually booked most of the production for this year to be able to share the vaccines once they've vaccinated their own population, and that it should go through the multilateral facility or directly bilaterally with countries. And that needs to happen. And then third, on the investment side, it has to be ramped up, and it should be done in a way which is not just the IPR waiver, because you do need to be able to have the manufacturing capability, the technology, the equipment, the raw material, the supply chain. These are not things that you can create overnight. So I think the short-term easiest way is to expand existing licensed facilities and provide investment flows into them. And IFC, which is the World Bank private sector arm, is actually looking at a number of potential investments to ramp it up and to make sure that there are no trade restrictions, both on the import of raw materials and being able to export from that hub to other countries. And I already explained the regional distribution on that. On social capital, I think I was looking at it more like the importance of communities and social capital to actually enforce good behavior. And also a lot of times they're also, when you don't have data, they can also identify who are the poor people who need assistance. And we have been using community-based. So basically what the bank did was work with government and then work through government, but the delivery is by community-based organizations. Like we delivered 225 million to 225 million women through a women's self-help program in India, for instance. So that I would say that's the power, positive aspect of social capital. And on the communication side, as Tikki also already mentioned, tokoh-tokoh, the religious leaders, or the tokoh masyarakat in each of these communities play a very important role to enforce behavioral change, but they need to have the right messaging. So I believe Indonesia, I remember looking at the vaccination plan of Indonesia, religious leaders was actually one of the priority groups to be vaccinated. But you asked me what ADB and World Bank should be doing. We are actually looking at how we can use social capital to have better communication, but they need to be equipped with the right information. And the government obviously has to work with these religious leaders to, I think at the moment, two important things. One is to reduce vaccine hesitancy, and second, to provide the correct information. Vaccines, yes, you still have to do containment, etc., and then still practice good behavior in terms of social distancing and so on.
Thanks, Mari. Tikki, would you like to comment? And,
you're muted.
You're muted still, Tikki.
Sorry, just briefly, Titik. Don't get me wrong. I'm not saying that every country should develop its own manufacturing capacity. That's clearly, not feasible. However, I think what is important here is the larger lower or middle income countries like Indonesia could be sort of their local capacity could be enhanced, for example, by the government providing more resources, not just to biopharma, but perhaps even to some national pharmaceutical companies. They have that capacity, okay, providing incentives. So if you promote local enhanced vaccine production in Indonesia, that could be helpful to other countries in the region which may not want to develop their own manufacturing industry. So I leave it at that to Titik's question. The other question on social capital, I fully agree with Firman that people value certain social norms and traditions, and that overcomes their fear. But you also mentioned that it's important that the messages are given in the right format by the right people so that they will then see this in a more balanced way. Okay, yes, we acknowledge that you want to maintain these traditions, but we also want you to be more socially responsible. Mari mentioned previously the importance of advances in data analytics. I just did a webinar with a group which is doing some wonderful work around computational linguistics and social data analytics. And one of the interesting findings is that they found that messages being sent by politicians, by experts, by scientists are less likely to resonate with the people compared to messages that come from people that they can relate to. Someone who looks like them, someone who talks like them. And they also found that messages that promote moral obligation tends to have very little effect compared to messages that say protection, hope, gratitude. So that's a quick answer to the two questions. Thank you.
Thanks very much, Tikki. So we're just about out of time. If I may seek your indulgence for 5 more minutes, if that's okay, Acho and Nuk, and also Tikki and Mari. There are just some more questions. I'll just read them out if you don't mind. You don't need to respond if you don't wish, but just to let you know what they are. So you'll know some of them. Professor Anne Booth in London. Hi, Anne. It must be pretty late in London. Maybe you're a night owl. Huh? So Anne says, if you don't mind, Anne, I'll just read it since time is short. Anne says, even if more vaccines can be produced in Indonesia, will the government be able to manage the complex logistics of delivery to over 180 million people? There are puskesmas in every kecamatan, but many are understaffed. Some even lack fridges, so storage would be difficult. Can they cope? And if not, are there other facilities to fill the gap, especially rural areas? That's from Anne. Thanks, Anne. Important question. Another one is from an anonymous attendee. Please don't be shy, but we'll take anonymous attendees as well. The anonymous attendee asks, are there any insights on how COVAX is allocating and distributing the vaccine? What is their decision-making process like to determine how much vaccine supply the developing country should get and who should get it first? That's obviously a very important question too. And just one more, if I can find it. It's from Nurul Isnani. And Nurul asks how to empower WHO in global vaccine governance while business and powerful private organizations have controlled the institutional mechanism and big countries are reluctant to show their global leadership because of vaccine nationalism and so on. And then related, how's the role of multilateral institutions, especially the World Bank, to facilitate more equal opportunities for certain developing countries? It goes on a bit longer, but that's the gist of it. And some of it has been covered already. Do you want to just, perhaps each of you, if I may, back to Mari and Tikki, just a couple of minutes, just any summary remarks, those particular questions or anything else you'd like to say. Tikki, could I start with you, please?
Yes, very quickly. I will leave the COVAX allocation question to Mari. She's much more familiar with this. Obviously, I agree with Anne Booth that logistics, transport, etc., is going to be the main challenge, especially to the far-flung regions of Indonesia. Let me just focus on Nurul's question. How do you empower WHO? Obviously, you know, I'm a little bit less objective about this since I used to work for WHO, and I'm still very passionate in the role of WHO. Just two personal views about how you would empower WHO. Firstly, give it more money, okay? As we mentioned, the budget is the same budget as a medium-sized US hospital. Give it more money, give it independence to decide what to do with that money. 80% of the WHO budget comes from so-called earmark contributions, where the WHO is obliged to spend the funds only in the areas that the donor is requesting. So more money, less earmarking. The second one, you need to reform the governance of the WHO. At the moment, the board of directors of WHO are the member states, sovereign states. Global health is a lot more beyond countries, okay? You need, for example, the pharmaceutical industry. See what happened with the COVID vaccines. That would not have happened. So they should be part of the governance. Civil society, okay? Philanthropies. You need to reform the governance of the WHO. That's gonna be aspirational. Countries, as I know in my 13 years with the WHO, are very protective to protect their sovereignty. I'll leave it at that, Hal.
Thank you, Tikki. That's a great way to end. Thanks a lot. Mari,
Hal, let me just finish on
yes,
a quotation that I hear, because going back to your initial question about what will the future looks like. Okay, I can't resist quoting this.
Yes, please.
I saw a quote from Mahmoud Ende, okay, our ministry, coordinating minister for law, security, and I can't remember the other one, okay? And he said, the coronavirus is like your wife. You think you can control it, then you realize you can't. So now you have to live with it. You have to learn how to live with it. Thank you.
Yes, that's an unconventional quote, but we get the message very clearly. Thank you very much. Mari, over to you for any concluding comments, generally, or those specific points. And you're still muted, I think, Mari.
This is the problem with these webinars. Let me quickly respond to Anne and the COVAX question. And I agree with you, but I think we have quite a, what would you say, innovative health minister. He's basically reaching out to many stakeholders to help distribute the vaccine. For instance, you talk about storage, delivery, and refrigeration. I know that he reached out to Unilever, and Unilever has repurposed its ice cream fridges to be able to store the vaccines. And you know, Unilever goes to the PLOSOC. They go to the very small rural areas. And he's working. And private sector can now actually also deliver the vaccine. The army, the armed forces are also involved. So you have to train, of course, a lot of people. On COVAX, the idea was that they should be doing advanced purchases, including also they work with CEPI who is doing the research side, so that, you know, the idea is that you have a pool of vaccines that potentially will become available. You know, some will fail, some will be succeeding. And then there are 92 very poor countries, of which they will be given for free 20% of the first need for that population. And then there are other countries that can buy from COVAX. But, you know, for poor countries, first 20% for free, and then after that they can also buy from COVAX. But at the moment, COVAX also experiencing problems with supply, and this is where the transparency of contracts become an issue. But I would say they are still, as a multilateral platform, a good way to be able to distribute equitably. I will just close by thanking all of you. I wish we had more time. I think these are really big issues. And I actually agree with the quote that Tikki ended with. You know, we will have to learn to live with this virus. It's not going to go away anytime soon. We need to, you know, adjust the way we live, the way we work, to adapt to the existence of this pandemic. And I think what will happen in the near future is that we will continue to work like this hybrid, you know, the hybrid way of working. And there's opportunities in there also. And the delivery of many things through digital technology is actually can be a plus. But, you know, many other development issues that we must face at the same time. And I hope that you will have another seminar, maybe in a year's time, to review where we are.
Okay, on that sort of slightly hopeful note, unfortunately, we've got to wrap up. We're already over time. This has been an absolutely wonderful webinar session, and it's been wonderful because we've had two wonderful guests, Mari and Tikki. Our deepest thanks to both of you. I mean, you speak with such authority and such insights, and you're able to cover not just the big picture, but also the micro picture, and not just the sort of your specialist fields of health and economics, but the sort of public policy, political economy interaction. So it's been such an enjoyable, lively session. So our deepest thanks to both of you, Mari and Tikki. I wouldn't dare to try and summarize, but I've made notes all the way through, and sometime I might have a go because there's so much we've learned from you. And Mari, definitely you're booked up, if that's okay with Tikki as well. You're booked up. We'd have you every week if we could, but that's a bit unrealistic. But if you're available, we'd love to book you up again for whenever, next year or sometime. But thank you both very much. We really appreciate it, especially Mari for you staying up late, and Tikki getting up rather early as well in Singapore. So thank you so much. It's lovely to see you both.
Thank you, Hal, and thank you, everybody.
Ya, terima kasih. Terima kasih semua.
Terima kasih.